Hi, my name is Dr. Debra Carter. I'm a clinical psychologist and I am the founder and clinical director of Carter Psychology Center. May is Mental Health Awareness Month, and this month our theme has been to focus on tools to help us thrive, not just survive. Earlier this month, you may have seen our series on the difference between worry, stress, and anxiety, and some of the tools you can add to your coping toolkit to help you manage in these uncertain times. But today, I want to talk about beyond worry, some screening tools and resources to figure out if you or a loved one may actually have an anxiety disorder. Are you one of those who are able to jump to worse conclusions in a single bound? It's not really a joking matter because there's 28% of the total population who at any given time will suffer from a form of anxiety. It is the most common mental health disorder. Some symptoms of anxiety disorders may include sleep problems, panic, uneasiness, cold, sweaty, numb, or tingling hands or feet, dry mouth, heart palpitations, tense muscles, dizziness. And there are certain kinds of anxiety disorders that are fairly common. One is generalized anxiety disorder, or GAD. GAD is an anxiety disorder that is marked by chronic excessive anxiety and worry that's difficult to control, causes distress or impairment in daily functioning, and is accompanied by 3 or more associated symptoms, such as restlessness, irritability, poor concentration, and sleep disturbance. There's also acute stress disorder and post-traumatic stress disorder. Acute stress disorder usually lasts between 3 days and 4 weeks. It usually shows up about 0 to 28 days after the trauma occurs, and having a pandemic is a trauma. Usually involves some antidepressant medication and short-term psychotherapy for treatment, whereas post-traumatic stress disorder lasts at least 1 month and can persist for several years. Because it lasts longer, the treatment tends to be longer also. This too often involves longer-term psychotherapy, medication, and a trauma-based type treatment called EMDR. Another type of anxiety disorder is panic disorder. This is where you feel terror that strikes at random. During a panic attack, you may also sweat, have chest pain, and feel palpitations, often strong or irregular heartbeats. Sometimes you may feel like you're choking or having a heart attack. If you or a loved one are experiencing any of these symptoms, you need to seek professional assistance and know that treatments are available. The most common treatments are a combination of medication and psychotherapy. Medications include anxiolytics, and those are drugs that may help lower anxiety. Examples might be Xanax or Klonopin. And they're often prescribed for social or generalized anxiety disorder. Many antidepressants can work for anxiety disorders too. Psychotherapy addresses the emotional response to a mental condition. Common types of psychotherapy to treat anxiety disorders are cognitive behavioral therapy, or CBT. This is where psychologists will teach you how to recognize and change thought patterns and behaviors that trigger deep anxiety or panic. Or ACT. This is another type of therapy. ACT stands for acceptance and commitment therapy. But be sure to ask your doctor or pharmacist before taking any over-the-counter medications or herbal remedies. Many contain chemicals that can make anxiety symptoms worse. But do know that treatment is available. People with no experience of anxiety may say things like, just have confidence. It's all in your head. Life's too short to be sad. But these things don't help. Finding the courage to get help isn't always that easy to do. But just know that we here at Carter Psychology Center are available to talk with you, to help screen your symptoms and let you know whether or not you may be experiencing an anxiety disorder and need actual treatment. To schedule an appointment, call the office at 941-753-0064 or go to our website to learn more about the telehealth options and the steps we are taking to make everyone safe. Stay tuned for the rest of this month for additional tools to help you thrive and move beyond surviving. Thanks.